So, impact. That's what we're all here about, right? We care about impact. As effective altruists, we seek to use data and evidence to try and do the most good in the world. Fundamentally, we care about having impact. So surely if we care about impact, we should measure impact, right? And how does one measure impact? Well, as I'm sure you've heard, the gold standard for measuring impact is the randomized controlled trial. Today I'm going to make the argument that it's not all about the randomized controlled trial. It's not all about measuring impact. And actually, we can have great effectiveness, great cost effectiveness, and fundamentally long-term impact if we seek to use data and evidence in innovative and alternative ways. So as was mentioned before, my name is Tony and I work in an organisation called ID Insight. And it's an organisation that's actually quite well known for running randomised controlled trials. So it might seem somewhat obtuse, somewhat unusual that I'm here discussing why we shouldn't be measuring impact. The first thing I just want to make clear is that the word impact actually has a very specific definition in economics. I'm sure there's a number of you here, and I can see some head nods, who come from the economic space or the data space. And so what you can see here is what we call capital I impact, or like an economic definition of impact. And it requires us thinking, what's the difference between the observed outcome and what would have been the counterfactual? What's the difference between what happens to a life if they receive a vaccine versus the exact same life if they didn't receive the vaccine? And that leads us to something that I like to call the counterfactual conundrum. Because unfortunately, we don't quite live in the metaverse quite yet where we can observe what would happen to that individual if they didn't receive the vaccine. So when I speak today about impact, you'll see that sometimes I'm speaking about capital I impact, and sometimes I'm talking about impact with a lowercase I, essentially the colloquial use of impact. So given that little bit of a digression into economics, and I apologise for that, it might be helpful for me to share a little bit of information about what it is that we actually do and why I'm claiming and standing here today that we shouldn't be measuring impact, or at least we shouldn't be prioritising it. I'll even go one step further, that it can actually be detrimental to be focusing on measuring impact, which might be very counterintuitive. So I think it might be most helpful to do this by actually talking about some of the projects that I've had an opportunity to work on in the past year. I'm going to go walk through 4 examples, and hopefully these examples will give you a little bit of an understanding around how we think about measurement or monitoring and evaluation, and when measuring impact may be appropriate or not appropriate. So the first example I'm going to talk about today is Educate Girls. Now, if you're at the keynote yesterday, you would have heard a little bit about Educate Girls already. I'll go into a little bit more depth right now. So, Educate Girls is an amazing organisation based in India. What they seek to do is they seek to get girls from ages 5 to 13 who are out of school into school. Now, you may say, if you know anything about education in India, don't all girls already go to school? There's sort of like this 100%, availability of education in India, supposedly. Of course, that's not the case, sadly. And in many of these underserved rural communities of India, where actually the vast majority of Indians live, many girls are not going to school for all types of different reasons. And so what Educate Girls seeks to do is go out, literally send individuals into these villages. These villages often have between 500 and 5,000. Sort of 5,000 is the limit of what we describe as a village, total individuals. And within these communities, you can have anywhere up to 100, 150, sometimes even 200 out-of-school girls, which is pretty remarkable in that small age range. So yes, Educate Girls goes out and literally knocks on doors and tries to identify these out-of-school girls, takes these girls to the schools with their parents and helps get them enrolled. potentially highly impactful work, particularly if we're talking about girls who are 5, 6, 7 years of age and able to get them into long-term schooling. This is potentially some very cost-effective, highly impactful work. So what do we do? The sort of ex-ante role was that these frontline health workers were either based in the communities or based in the states that these communities sit in. Actually, I should just give you a little bit of an understanding of the states that we're talking about, because it's sort of remarkable, especially as we're sitting here in Australia. There's one state in India called Uttar Pradesh. It's a far northern state. It's also bordered by Bihar. These two states each have more than 200 million people. I think UP has something like 300 million people. It's just mind-blowing the numbers that we talk about and the opportunity that there is for impact given the scale. So we have EducateGirls sending frontline workers into these communities. They tend to know these communities pretty well and often have been back to the same districts. And you can think of districts as sort of like the provinces within the state. They go back to these on an annual basis to try and get girls enrolled into school. And they do a really good job. They know the people in these communities. They have personal relationships with the schools. They have relationships with the parents as well. But they came to ID Insight a number of years ago, before I was there, and said, is there a way that we can improve how we go about targeting? And targeting is the key word. So for those data scientists in the room, and I know there's a lot of folks who know a hell of a lot more about data science than I here, targeting is when our ears perk up and we go, oh, machine learning, prediction algorithms. We can start using really cool data to try and identify where to target resources most effectively. And that's what the team has done. So over the last 5 years, we've worked with EducateGirls to prepare this machine learning algorithm. It's a random forest-based model. And we use a combination of publicly available data and private data, as well as the historic data from prior years as well, to constantly retrain the model and try and improve the number of out-of-school girls that are identified by these frontline workers. So what we literally deliver to EducateGirls, and we delivered earlier this year, is a list of communities, some of their metadata, relevant characteristics, the number of out-of-schools we predict will be in that community, and then they go and check these communities. And we also think about, it gets a little bit more sophisticated because we want to make sure that if we're sending Mrs. X enumerator to, I don't know, Perth, we don't also want to be sending Mrs. X to Brisbane. So we think about geographic sort of clustering as well to sort of optimize the number of out-of-school girls that could be identified. And as I mentioned yesterday, we estimate that this has led to over 600,000 out-of-school girls being enrolled in school. Just a completely remarkable number. I'm not sure in Australia how many school children or girls are there between the ages of 5 and 13, but if I were to do a BOTEC on that, I wouldn't be surprised if it's less than 600,000 in the whole of Australia. It's just the numbers are huge. The numbers are huge. Example number 2. It's an organisation called BRAC. And you may have heard of BRAC before, and it would make sense that you have because it's actually the largest NGO in the world. It's based in Bangladesh. It's known for actually something called the graduation program. But I was part of a team that was working with their health, nutrition and population program. Also a massive, massive program. So what does BRAC do within this program? Once again, they deploy frontline workers. What they're doing is they're actually going out into the community and supporting families, providing prenatal, postnatal care to women, and also providing early childhood support to those children that are born. They also provide with eye services, vaccination services, knowledge, and a whole wide range of various services for families. They work with over 80 million people in Bangladesh. The numbers are absolutely huge. And they have, as you can see up there, over 50,000 frontline workers that are going out on essentially a daily and weekly basis to identify and support these families. So what did we do? Late last year, BRAC moved from a pen and paper model for collecting information into a digital model. They use something called mHealth, which is a quite common software platform in the health space, at least in the development sector. And they're now collecting sort of digital records from each one of those 50,000 frontline workers on a daily basis. So they literally go out with tablets, and when they're providing services to families, they're going through and filling reports and checklists, and that data is coming through. What our team did was build an ETL system. And so ETL is what we call extraction, transformation, and loading. You can think about it as creating a big data pipeline. There's all this huge data set that's being collected every day, every hour, every minute. We create a funnel where we extract it. We take all that data. We transform it. We do a little bit of analysis to it. We create data from the information. And then we load it into something. And what we loaded it into is a real-time, well, technically we load it into another database, but we then take that data and we create a dashboard. And it's a real-time dashboard with over 150 indicators that the leaders at BRAC can now use to actually measure the performance of their program on a daily basis. Now, maybe that doesn't seem like much to you. It's a remarkable change from where they were before, where they were getting literally pen and paper for 80 million people, moving to a system where they can get daily information on what's going on. Like, if you've been watching the news recently, you may know that Bangladesh has been sadly in the news because of the terrible flooding that has occurred. BRAC is now able to see which families, which communities, which districts are underserved because of the flooding. They can try and infer areas that may be at higher risk. They know where families are located, and they can deploy services to these locations to try and support mothers who might be soon to give birth. There's a limitless number of opportunities to use this type of near real-time data to improve service delivery. So what does impact with a small I here look like? Well, currently the 3,000 leaders in the BRAC HNPP are now using this dashboard to support over 80 million beneficiaries. Example number 3. We did some work with an organization in India called, it's got a long name, but I'll just call it Tata Power, just to reduce it down. What does Tata Power do? So India is a coal-based economy. And if you've had an opportunity to listen to Lily speak at the Clean Air Task Force, what is obviously really important is developing this equitable energy transformation, where it's not just about reducing energy usage, because that doesn't support those in lower middle income countries as they seek development. They require energy. It's about an equitable transition to energy, where those who need energy are able to get energy, and those who have surplus energy use less energy. Now, this is a challenge in India because it's a coal-based economy. A lot, and is very carbon intensive. A fundamental challenge with energy is last mile delivery of the energy. It's all good and well to have the coal power plant or even the solar mini grid, but how do we get that energy into people's homes, particularly in a country where over 60% of individuals are living in rural communities? Very hard to get to, often don't have roads going to them. This is where companies like Tata Power come in. They are what we call distribution companies, or in energy lingo, discoms. They don't produce the energy. They provide the last mile services. They get the energy from the coal plant, or even better yet, the solar mini grids, to these rural communities. But as you can imagine, that is not a very financially lucrative job to do. Those individuals that are being targeted generally are relatively impoverished. So their ability to pay, their willingness to pay is quite low. And the government's not doing it. And the supply is often not particularly good. It's a tough place to be in. So what did we do? Tata Power did not have a very good understanding. Also, the government of Odisha, which is works with Tata Power in a public-private partnership. I won't go into the details, it gets a little complicated there. They wanted to understand what's actually going on in the ground. Is there a way to support this discom and fundamentally the beneficiaries of these services to ensure that they are getting reliable, high-quality energy? And they didn't really have insights into that. So what we did is we conducted a set of structured interviews with those beneficiaries, with those customers, to really understand what are their wants and needs. Do they even care about energy? That's just like a fundamental assumption. That's often not the case. What is their willingness to pay for energy? What is their actual experience of the energy that's being distributed from Tata Power? The impact? We identified a whole bunch of assumptions which Tata Power and even ourselves were getting wrong. And thanks to now having this deep insight into what the people actually wanted on the ground, Tata Power is now able to distribute energy more effectively to the over 500,000 customers that they work with. Now, some of the assumptions that they were making around something called billing, metering, and collecting. So Tata Power had deployed meters, and I'm sure you've probably got meters as well, which tell you the energy usage. And the idea was that if you have a meter, you're going to be more equitably charged. What we actually found is that before a customer had the meter, they were charged on this sort of like averaging basis. And this averaging basis actually undercharged the vast majority of users because there was these couple of companies in each rural community that used a large proportion of the energy. So they were getting undercharged. So when the meter went in, what it actually led to is people being charged the appropriate amount for what they were getting used, which happened to be a little bit more. And this resulted in people actually changing their consumption habits. We're talking about consumption habits here where a house has 2 light bulbs, a small refrigerator, and a fan, in many cases. They use, on average, less than 1.5 kilowatt hours per month. Your fridge uses 250. It's mind-blowing. So they're making decisions of when they were going to turn on the light and they were going to turn off the light because of a change in the metering system. And that's the type of insight you simply don't get from your armchair as you see the data coming through. It requires you going into the communities, or in this case, having phone calls because of COVID, we couldn't go into the communities. So that's the third example of something that we do. Fourth example, Niti Ayog. So Niti Ayog is the public policy think tank of the government of India. And they do some really cool things. They're quite an innovative government institution, particularly in a country like India, which is not necessarily known as being the most innovative. So at ID Insight, we do a lot of work with Niti Ayog because they are quite passionate about using data and evidence to try and improve public service delivery. So I was part of a team that helped design an outcome-based financing scheme. Some of you might have heard about development bonds, DIBs, or results-based financing. It comes in a lot of flavors. Essentially, what outcome-based financing is, the idea of paying based on outcome. So it's in the name. Imagine most governments pay on inputs. They want a road or a bridge built. They run a tender. They do a request for proposals. All these organisations bid, and then they pay someone to go and build the road. Once they pay someone, in economics we call it the fundamental transformation problem. Once you've paid them, all the incentive of actually delivering that bridge, building that bridge effectively, largely goes away because they already have the money. There's a real issue in economics. Outcome-based financing seeks to pay based on the outcome, based on how good the bridge was. Did it actually meet the dimensional characteristics? Is it safe? Is it got all the amenities that they said the bridge would have, et cetera, et cetera? So Niti Ayog is, we're still in the middle of this, it's actually getting deployed next month, is interested in designing one of these outcome-based financing schemes to try and incentivize education technology companies in delivering edtech solutions in schools, in underserved schools. Which is a very interesting, quite innovative model. So what did we actually do? So I was part of a team that figured out how are we going to measure success. So the way the edtech companies get paid is if they meet a certain target. If students actually learn, then they get paid. If the students don't learn, they don't get paid, similar to a bridge. If the bridge doesn't meet the dimensional characteristics, the architects, the engineers, the builders don't get paid. But it's not as easy as a bridge, because when we're talking about student learning, we're talking about a couple of 100,000 children who are going to be part of this program. How do we actually measure success in student learning? There's a risk that we could be measuring the kids who are already successful and then just incentivizing edtech companies to keep on focusing on that. Maybe that's okay, maybe that's not. Do we care about the children who are most suffering, have the lowest outcomes? Do we want them to increase the most? Do we want to max them in, as Rawls might say? Maybe, maybe not. So this becomes quite a philosophic, theoretical challenge, and on top of that, we need to set targets which are both realistic but challenging. Because if we set the targets too low, then we'll just be distributing funds willy-nilly, and it won't really serve the purpose of an outcomes-based financing scheme, which is to incentivize outcomes. So how do you determine what an appropriate target is? Well, you need to look at the research. You need to do a literature review. You need to understand what is generally the effectiveness of education technology type programs in these settings. So the impact, small I, is that we designed a randomized controlled trial type of model, which will be deployed now in the next couple of years, which will be working with over 200,000 children in a couple of states. Now, I've given you 4 quick examples of work that we do at ID Insight. And one theme that might bring them all together is none of these involved running a randomized controlled trial. None of these involved measuring capital I impact. And I would argue that they were highly impactful. Can I give you the counterfactual gold standard? No. But should we be investing as a community in these types of projects which have little I impact? I argue strongly yes. And that there are thousands, tens of thousands of opportunities to pursue these types of projects. And they're super exciting. Randomized controlled trials are fun and all, but they get awfully academic. This stuff, I will promise you, is really fun and exciting to do. So, given that claim, how can we think about where these opportunities lie? When may a randomized controlled trial actually make sense? And when should we be doing these other types of projects? And this is where our best friend, the theory of change model, comes in. And I understand someone spoke about theory of change earlier today, which is awesome. Because this really is, and I know Judith is here and she spoke about it yesterday, this is really at the core of how we think about using data and evidence, monitoring and evaluation. We always come back to this theory of change model. It is a broken record for us. So I'll be very quick here because I expect many of you may already know what a theory of change is. But simplistically, it is a visual representation of a causal statement. I said I was going to be simple and then I used all that jargon. What is a causal statement? X leads to Y. Does X lead directly to Y? Almost never. X leads to Y through A, B, C, alpha, gamma, omega, and usually a bunch of other things. And so what we try and do is we try and unpack how X is leading to Y and then interrogate each of those links. Because using data and evidence, we can then really understand, does X lead to Y? But more importantly, does X lead to A, lead to B, lead to C, lead to delta, lead to blah, 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 blah. So that's where a theory of change becomes helpful. So I've just got a short example here. This is very simplistic. You can think about a simple model where we have farmers who are suffering low yields and consequently low incomes. There's a theorized input or intervention or program or company where they deploy high-yielding seed varieties and distribute it to farmers. Not dissimilar to the Green Revolution and the amazing development outcomes that came through that. So that's the input. The output is the tangible thing that comes out of the input. In this case, the farmer is receiving the high-yield seed. Seems pretty straightforward. The outcome is the change in knowledge, attitude, or practice, and/or practice that comes from that output. So the farmers are using the seed varieties and it leads to yields increasing. And then what we care about fundamentally is the impact. Incomes increase, welfare is improved, subjective well-being, dignity, we can call it whatever we want. Now this is an extremely simplistic version of a theory of change. This is what they generally look like in our experience. And so it's not so simple as just to stand here. We usually spend and work with partners for days, if not weeks, with whiteboards to really try and break down a theory of change. They're tough, and it's worth the time that's invested because it helps us then think through what is the right tool for the right questions. And once we know what the right tool is for the right questions, we can think about the data and evidence that needs to be generated. So, if we have questions between needs and inputs, we have a need. Farmers have low yields and low incomes. What should be the input for that? Often the appropriate tool to use is what we call a needs assessment. It actually means going out and validating that it is the low yields that are leading to the low incomes. It is actually the lack of educational technology that's leading to these low student learning outcomes. Is there actually a need? And this, I think, is an area where, as EAs, we often struggle, is we have very strong assumptions about what we believe the needs are in the world. But how often are we actually going out there and doing a needs assessment to validate it? This can be very challenging. You cannot ask a fish in deoxygenated water, as much as we would like to, whether they would like more oxygen and maybe be fed less regularly. But the folks at Fish Welfare Institute are trying to understand that at the moment. So obviously, there are other techniques to this, but simplistically, a needs assessment provides a helpful tool there. Between inputs and outputs, just remember, an input is the thing that we're doing, the organisation is doing. The output is just the very simplistic thing that comes out of it. You run a teacher training program. The output is the teachers attended the training program. The output would be that they learnt something, that they graduated from the course. What we seek to do is we use monitoring. We identify a set of key performance indicators or metrics, and we measure them. Outputs to outcomes. This is often the most challenging sort of space. An output is the direct thing that happened. The outcome is the second order change. If you remember, it's the change in knowledge, attitude, and practice or behaviour. Now, many people jump over this step because it's often not the most exciting. Does that teacher training program, which a teacher actually graduated from, lead to a change in his or her learning or knowledge? Does it change the pedagogy that the teacher has when they're in the classroom? It's really tough to measure changes in knowledge, attitudes, and behaviours. Did coming to this EA conference you attended, you sat in my talk, is it going to change any of your attitudes or behaviours in the future? I hope so. How do we measure that? Very difficult. Very difficult. That's where process evaluations come in. And finally, we have a randomized controlled trial. And it's only once we've understood the rest of that theory of change that it really makes sense to jump to this final stage and measure impact. Because if we don't understand whether the rest of it is there, sure, we can run a randomized controlled trial. Absolutely. We could randomize the number of people who attended this talk today versus those who couldn't attend this talk and see the changes. But could we really understand the cause for that? No. Could we really understand the implementation? No. Could we understand the need for coming to it? No. So we're jumping to the final conclusion without understanding the rest. And even if we find that it's impactful, we don't know why. We can't generalize. So it's for that reason that we urge organisations consistently to think about identifying the right tool at the right time. And the right time for conducting an impact evaluation is actually quite small. Let's go back to those 4 examples that I mentioned before, those 4 projects I've worked on in the last year. That Educate Girls project that I was talking about, the one where we were identifying communities with relatively more out-of-school girls, you might remember. What data did we use? Publicly and privately available data. What techniques? Some pretty cool machine learning stuff. I think it's a really interesting example of data science for good. And what value did it bring? It allowed the inputs to be better targeted. It is extremely far away from running a randomized controlled trial. It ensured that the limited resources of Educate Girls could be targeted and pointed at communities that were going to have a greater likelihood of impact. BRAC. You might remember that this is where we worked with the Bangladeshi NGO to develop this dashboard and this ETL system. What's the data that we used? It's existing data. It's already being collected. I've already discussed some of the techniques and the value. This is a pure monitoring system. The dashboard is literally just collecting a bunch of data which gets turned into KPIs and then visualized on essentially a near real-time basis so that decision makers can make better decisions. It's very far away from measuring impact. It's a monitoring system. It's a cool monitoring system. It's a big monitoring system. That's all it is. The Tata Power work. This is a prime example of what we call a process evaluation, where we actually understand whether the implementation is occurring on the ground as hypothesized. And this is extremely helpful because Tata Power could go and just run a randomized control trial. They could randomly identify some rural communities where this DISCOM will operate and some that won't, and have a look at the outcomes. But would they be able to determine whether the reduction in usage in some communities was because of the little monitor being in place? Absolutely not. That's so counterintuitive that the little monitor actually is the thing that led to a reduction in energy usage. We would get the data back and it would say, this program doesn't seem to be working. Those communities where the DISCOM is operating, they're using less energy. I wonder why that is. It would take a really long time to figure out. I would argue that it was because of that monitor. And so understanding implementation before we understand impact is critically important. And of all of these, I think process evaluation is the one where there's the greatest opportunity for us as a community to really do more. And then finally, the Niti Ayog project. So this is actually an example of where a randomized controlled trial design can be used in an innovative way. Now, what we're actually doing here, and I didn't go into all the details before, is we've actually designed an RCT where some treatment schools will receive the EdTech services and some control schools in the same state won't receive those EdTech services. And the targets that we set on those companies will actually be based on the difference between the treatment and control. So the targets are actually based on the effect size that is driven by the intervention. So it's an RCT design, but used in quite a unique, different way, not the usual way that we use RCTs. So I'm hoping that through these 4 examples, you've seen sort of like the exciting, interesting opportunities that exist to use data and evidence in ways that aren't just measuring capital I impact, and that we can have a lot of small I impact through these other techniques. So how do we take this forward? First, ensuring that there is a clear need. Asking people whether they want what we believe they want. This is critically important. It's critically important just from an axiomatic ethical perspective. But even more than that, I argue that it will help us drive more impact if there's a fundamental need for the services and goods that we seek to provide or support with. It helps maintain dignity, subjective well-being, let alone improvements in welfare outcomes. Secondly, supporting organisations as they seek to monitor their programs. This is a key challenge that a lot of organisations face. They are pushed to provide details on the amount of impact that they're having. Tell us your effect size. We as EAs, we want to know what's the standard deviation change because of this program. We want to see the meta-analysis of these interventions. Let's support the organisations just monitor their programs first before we're pushing them to give us an effect size. Now, ensure that they can walk before they run. How do we support them in doing that? I think we should do more. And finally, evaluate implementation before impact. And if there's nothing else that you remember from this, this is the one thing that I would urge you to remember, is supporting implementation for organisations. We can identify, for example, that conditional cash transfer, similar to what Give Directly does, is highly cost effective. I think there's a lot of evidence to suggest that right now. Does that mean if you gave me the resources that Give Directly has, that I would be able to drive the same amount of impact as Give Directly does? No. Why? Because they've learned how to implement their program. It's not as easy as saying unconditional cash transfers lead to impact. No, it's how they're implemented. And so we need to ensure that we're supporting organisations implement effectively before we start evaluating the amount of impact that they can have. And this might seem super intuitive to you and really simplistic, but it is surprising how often we're seeking to measure impact before we even know organisations can implement the programs. Once we do all of that, sure, let's run the randomized control trial. Randomized control trials are not evil tools. They're actually extremely effective, but what they're extremely effective in doing is measuring the effect size of a certain intervention in a certain geographical context in a certain period of time. And for that, they're fantastic. They are the gold standard. They are the best thing we have to countering the counterfactual conundrum that I mentioned before. But that's awfully narrow. We seek to generalize when we can, but it is difficult. It is difficult. So I bring it back to impact. And I hope, at least to some extent, I've persuaded you of the claim that it's not all about impact, but rather it is about building these sustainable, robust, data-driven decision-making systems where we can actually support entrepreneurs, nonprofits, governments, foundations, philanthropies, answer the key questions that they have using data without urging them and pushing them to measure their impact before they're ready.